Hey guys, Will Albanese here with Aspira Health. I am a clinical pharmacist and managing director of Aspira, here with my good friend and confidant, Chris David, marketing director for Aspira. Cheers, bud. We got
Cheers.
Red Bulls out. You were just talking about COVID, and we were referencing the numbers in the area, and kind of drilling down on it, right?
Yeah, everybody's favorite topic. I mean, we can't talk enough about COVID, but
Kids love it.
with news kind of changing on the daily, sometimes it's difficult to really understand what's happening in your backyard. One thing that we had talked about was trying to provide accurate and up-to-date information for people in Sussex County and Lewis, because there's a lot of frequently asked questions, and we just kind of want to streamline communication with the patients and prospective patients who are looking to use Aspira as their trusted source for COVID information and vaccines and testing.
Funny you mention up-to-the-date information, because one of the things we've been doing since November of last year is we actually post all the testing numbers that we do each day on our website, aspirahealth.net. So that's unique. I got the idea, I think, from the New York Times, where they were showing, the daily flow increases and decreases. So if you're ever interested to know what exactly is going on right here at Aspira and in the county, you can look up our numbers on our website. They're right there in a giant graph that's infographic, it's interactive, and you can click on the date and look at how many tests were positive, which are actually more than you would think. Right now, we're testing somewhere between like 80 and 180 a day, depending on the volume.
Right.
And anywhere between 10 and 40 are coming up positive. So
Wow.
we are reporting that many positive cases to the state.
How has that changed over the last couple of months? Or is that an increase, decrease, flat? What is it?
So right now, in the middle of October, we've got our numbers kind of trending down a little bit. Testing's going down, positive cases are going down. That's nationwide. We're following that nationwide trend. I believe Delaware had somewhere around like 360 positive cases. So when we reported, I think we reported 15 yesterday.
But that's still trending down?
That is actually trending down, yeah, actually.
You think it's because of the vaccination or the seasonality of the virus?
Hard to tell. I think it's the natural, we had that Delta surge is kind of what we just came out of.
Is that what everybody's getting right now, the Delta variant?
The Delta variant. Wait till you see the Lambda variant.
Is that a real?
There are real variants out there.
Is it really?
Yeah.
Oh, jeez.
Yeah. So I mean, and that's one of the problems with viruses. Is viruses are very short segments of DNA, so small mutations and they replicate so many times. I mean, you and I replicate once in a lifetime, our kids, right? Viruses, they're replicating billions of times in our lifetime, just constantly. I don't know the life cycle exactly of a coronavirus, but each time it replicates, its DNA changes and can potentially mutate. Not to mention when it spreads from person to person, and then it, builds up in their system. Those are all replications that are occurring, and therefore different variants are coming out that make the virus less susceptible to the vaccines.
Okay. So is this, I don't want to get down the tangent of, is this the new normal, but
Is this the new normal?
What's going on specifically in Sussex? Are we seeing more ICU cases with people that are staying in the hospital, or those who have gotten the vaccine? Maybe they did get hospitalized, but it's not as bad, or they're out sooner. What's going on with all that?
Yeah, so one of the trends we're seeing with the Delta variant is it's definitely affecting the younger people more. It used to be, it's kind of scary, because you used to think you were immune, and now we're like, no, I was pretty sick. I got an ER nurse who works over at the hospital, and he has got zero body fat on him, and he's like a 20-something guy. He got COVID. He was down. He was like, I am flat out down.
And he was vaccinated.
He wasn't actually vaccinated, but it drove him to get vaccinated. And you can get vaccinated as soon as you get out of your quarantine. But we were also talking a lot about what's going on at the hospital and the ICU. I used to work over at the hospital, and I rounded in the ICU. I was the clinical pharmacist for the emergency department. So I still hear a lot of stories, and we talk a lot about what's going on over there. One of the trends they've seen right here in Sussex is that the younger people are getting sicker and going to the ICU. Where it used to be 50, 60, 70-year-olds in the ICU, it's totally normal now to see 30, 40, 50-year-olds.
So 30 being younger, not like our kids who are 4, 3, 4, 5.
There are some pediatric deaths that have occurred due to COVID, but they're limited. I think they're around like 300 nationwide.
And do they have like predisposed conditions to anything else?
Not sure. I'd have to check into that. But we do know that with the virus, as it mutates, I mean, the way the virus survives is infecting people. I mean, that's, the essence of a virus. It continues to thrive as long as it's active. So it just finds different ways and different people to infect. And, one of the things it's doing is affecting younger people right now.
Wow.
Yeah, kind of scary, but, you can still get vaccinated right now, 12 and up. Can get vaccinated with the Pfizer vaccine. And they're even probably going to expand that down to 5 to 11, or at least there's data that's been submitted for them to look at.
And are you doing boosters right now?
We are doing boosters. We're doing mass vaccination events for anyone that got their vaccine 6 months or more ago, if they're a regular 65 and older person. Or if you're 18 to 65 with certain health conditions, you can get the booster. And then if you're immunocompromised, they're actually recommending that 28 days later you get that third shot right away.
And so, like, the antibodies that you get from those first 2 shots, do they kind of taper off over time? And do you think that we're going to need to continually get boosters every 6 months or every year?
I do think we're going to continue to get boosters. I think you're going to have to.
It's going to be like the flu shot?
Yeah, your body just doesn't mount a very strong response to viral infections. They tend to taper pretty quickly over time. So, well, some of them I should say, this one being one of those. So basically, in this case, they've seen the antibodies taper over time. They've seen hospitalizations begin to go up over time. So the public health sectors all say, hey, looks like you better go get that jab, as the Europeans call it, right?
Yeah, right.
I think it's so funny. It's not an injection, it's a jab.
Yeah, or anyway.
That's what I do with someone's ribs,
The
jab
ouchie.
them in there.
Yeah.
Fauci, ouchie.
Yeah, oh my God. Yeah, I would have thought with school being back in session that we would have seen the spike, but is it just that kids are asymptomatic, may not know that they have COVID and they go out and they spread it, or?
It could be part of it. Yeah, there could be the asymptomatic spread, and not just kids. Healthy adults all the time.
Yeah.
You could be vaccinated and still have viral particles that you're shedding in your nose. You're just subclinical, meaning that you don't show up with symptoms. And that's actually happened here. Lots of people come in and say, oh, I'm just getting tested for travel. And we swab them, and I'm like, I'm sorry, no Disneyland for you. And it's heartbreaking.
It is.
But then they say, I did feel, I had stuffy nose, I had a headache. And those are vaccinated people saying that. The big difference we see between vaccinated and unvaccinated, the way I describe it is, well, if you're vaccinated, you come in with that stuffy nose kind of deal and a little bit of a head cold.
Yeah.
But if you're unvaccinated, the people that come here generally leave their car in the parking lot because they end up going to the hospital in an ambulance. It's scary. And I try to tell people that, I say, hey, listen, you should get vaccinated. But at that point, it's too late. If you're coming in with an active COVID infection and you haven't been vaccinated, your body is left without any defenses really to fight it off except its own immune response, which takes 2 weeks to build up. So.
Yeah, you can't really get the vaccine once you have symptoms.
Right. There was a heartbreaking YouTube clip, the guy was in an ICU bed and they were getting ready to intubate him, which is sticking a tube down your throat to push air in and out of your lungs.
Yeah.
And he was like, no, doc, I'll take the vaccine now. And the doctor just said, I'm sorry, it's too late. It does take that 2 weeks.
How did that get up on YouTube? Who recorded that? I feel like that's a bit of a HIPAA violation.
Could be.
Just
It wasn't me. I'm not signing in. I'm not hanging out in any ICU arenas, but I support the effort to vaccinate people. It's the safest, easiest way.
So the symptoms, I remember back when COVID originally came out, it was this dry cough, and now you're saying it's more a headache and stuffy nose. Is that the Delta variant?
That is actually more just like the mild signs. So I'm just referring to those as people that, have gotten vaccinated, are able to fight off the virus, and then they just have very mild symptoms.
Yeah.
The symptoms are still the same between the variants and with the COVID-19. You're still talking about the cardinal symptom, and one of the differentiating factors is still that loss of taste or smell.
Right. So that's still a constant.
Absolutely. So we do the test where we put a jalapeno on everyone's tongue that comes in.
Oh yeah, that's a good test.
We should really partner. We need we need a Mexican restaurant to sponsor this segment. Can we do that? Is that
I'll
possible?
look into it.
Maybe La Tonoteca, hashtag not a sponsor. We'll see what we can do. But yeah, the taste or smell, you lose that and we go, you better get tested,
Yeah.
Big other ones are fever. Other ones are cough.
Right.
Basically, the same stuff you're getting with most colds, just that these are going to be so much more severe in the long run. and we're finding out that COVID really ravages your vital organs. We're talking about myocarditis and pericarditis, where it's attacking the tissue of your heart, you know?
Yeah, so this is more of almost like a cardiological, is that the right term? Cardiac?
Cardiac, yeah.
More of
We tried to make it sound bigger,
yeah,
sound
right,
smarter.
right.
Yeah, right. No, I've done that before. That's not a real word, Will.
Yeah, well, put it in the dictionary. It is now. So this is almost more like a cardiac disease over respiratory.
No, well, it is predominantly going to lead to pneumonias, which are your lungs getting affected, and that's what's ultimately going to cause the most damage and lead to sequelae and death. Is predominantly with the lungs. However, we're finding that it does attack other organs.
Yeah.
Another good example of this is this just came out where they're actually urging pregnant women to get vaccinated. And the reason why is if you do get COVID while you're pregnant and you have a bad infection, it's attacking the baby, it's causing complications, and those are very hard to manage in the setting of a highly infectious disease when you have enough problems with a baby alone, you know?
Yeah.
And there's nothing wrong. I want to stop and just say there is no evidence whatsoever that the vaccine affects any type of fertility, has any effect on the baby. It's actually shown to be protective. It's great. You get the passive antibodies, so the child's protected too.
Yeah.
So just like everything else, the best thing you can do for yourself and for your family is to get vaccinated.
Right.
I'm really plugging that hard. I don't know if you noticed that. Big advocate here because it's the best thing, and all the stuff you hear is all false. Like all the bad things, they're very limited and they're right in line with any other vaccine.
Well,
So
speaking of which, can I get my booster shot later?
yes, sir. We're doing a gluteal, right, for you.
Yeah, please. Thank you.
I only take them in the behind. No, we do all boosters in the arm.
Yeah,
Deltoids is just fine.
nobody really does that anymore, do they?
I had one guy drop his pants. He was ready
Really?
for the shot, yeah. And I was just like, no, it's okay, sir. But that is a great tattoo.
Was it in the waiting room? Well, if somebody has symptoms, what should they do? Should they call? Should they call and make an appointment?
If they have symptoms, if you're feeling under the weather, you can come into Aspira. You can walk in. We have a wait most of the time, but we try to get you seen as quickly as possible. It's normally reasonable, 15 minutes up to an hour or so. Most people are in or out.
But people should really text on the website, though, right?
Absolutely.
What is that
you can
number?
text us. Yeah, you can text us at 302-517-1385.
And we'll include a link to that telephone number in the description, as well as if you go to the website, and you might have to scroll for like a second, and you'll see a little text us pop up at the bottom. You click that, it's going to take you directly to your SMS app, in which case you'll have a responsive Aspira representative on the other side aid you in scheduling your appointment.
Anytime you have a problem.
Yeah, really anytime. It's more than just COVID.
8 a.m. to 8 p.m. we're here. Someone's going to answer you if you text us.
That is the preferred mode by which to communicate. Most effective.
You know, we really should get like together and see if that number spells something. Like it should be, you know, like what does 1385 spell? Is it like
1-800-JAB now?
Jab now? Yeah, we need like some, I don't know, acronym for that. We'll have to look into. I think there's like an app online.
You don't have anything else going on today, right?
Yeah, I'll just clear my schedule.
You got no more patients.
Oh, but we're between two patients, guys. We have to go back to patients. So yeah, but the texting is definitely the best option. I definitely want to find out if that spells something. I think the one's the hard. Is one's?
You're
A,
asking
B,
the
and
wrong
C.
guy.
Yeah, it's been a while. I used to try to see if my phone number spelled something cool. It never does. Yeah.
I don't wonder how much that costs. Well, anyway, thanks for informing everybody and myself about COVID, what's going on in Sussex County, as well as what's happening across the nation. Oh, quick question before we cut out. Yeah, what do you think about the seasonality of the virus? Do you think it's going to spike again once we hit the winter?
Good question. I think that with a lot of kids back in school, they are masked. A lot of schools are masked in Delaware, which is good. That's the best way you can prevent the virus from spreading. But I also worry that there's a lot of get-togethers outside of school. I think people are letting their guard down a little bit. I think there will be another spike at some point. It's hard to tell when. Right now we're waning. You know, we just dropped below 100,000 cases a day as a nation.
That's great.
But I think it might go back up.
Yeah.
And I do worry that people are going to think everything's COVID, rightfully so, as they start to get cold and flu symptoms with the seasonal changes here. Best thing you can do is get tested. And, you know, one of the standards we have now is we have what I think the nation will be going to is 4 tests all in one. One swab will get you COVID results, flu A, flu B, and RSV, which are all known to cause illness in people and infection. So that's going to be the standard, because no longer, gone are the days, hey, you don't feel good, let me swab you. Hey, it's not COVID. Well, great, you still feel bad. Let's get you checked out. What is actually causing it? If you don't follow up and get that answer, you need additional testing. So what we're doing now, and what I said, I think will be the standard, to do all 4 in the same time.
Wow.
Yeah.
When do you think that'll come out?
I think CMS will probably mandate it probably by this season. I don't think it'll
Okay.
It's really coming up. We offer it here. We do have it for symptomatic patients. So if you come in and feel bad and you're looking pretty sick, we'll probably do all 4 on you at once.
Wow. And we do have the rapid PCR test where folks just schedule online with that text message, drive up, get the swab, drive away, and then you update the patient portal or get a phone call with your results. Pretty easy, right? That's accurate?
Oh, 100%.
Yeah.
This is PCR technology, which means we're talking about 97 to 99% accurate. We're talking about actual DNA molecules specific for those organisms. So we're laser beaming in right on these guys.
Yeah.
And then we're getting you results right away via your patient portal. So, you leave here, by the time you're home, you probably have results waiting for you that you can print out and hand to whoever you need to. Daycare, school, just proving your wife wrong, who knows? I have no idea.
Traveling outside the country.
Yeah, side bets, whatever.
Yeah.
Oh, he's referring to legitimate reasons.
Oh, yeah.
I just do, I do it for fun, but no, it's all right there. And it's designed to get you back to where you need to go,
Right. Well, I mean, in the past, you had to do the rapid test, and that was only how effective was that?
Yeah. So and there was lots of caveats to the rapid test too. Rapid test is about 85% accurate with symptoms, and those are some of the better ones.
And you
also
still have
have
to stick
ones-
around for the results, though.
What's that?
You still had to stick around for the results, whereas with now you got the PCR where you get the swab and then you can.
You can get out of there, yeah, provided you can get to the patient portal. But yeah, it's you can leave right away. You don't have
If
to
you're
stick
not
around.
symptomatic.
Yeah, and so there's caveats, like I said.
Right.
So, but you're dealing with a lot of things. There's a lot of changes. One of the reasons why we're having these talks is because medicine has changed dramatically in the past year. So never in a million years did I think PCR technology would be the standard for testing people. But here we are with these, very elaborate machines almost going into medical offices across the country to try to diagnose and accurately treat COVID.
Yeah.
Yeah, it's crazy.
Wow. Well, can you get the flu and COVID at the same time?
Yes.
That would be a scary one.
Just like let's just leave. You can get multiple infections at the same time. I was off
Not
on a
a
tangent
doctor.
there. Yeah, hashtag not a doctor. But Chris, it was a pleasure talking with you today. Probably
Well,
got to get back to the patients.
Yeah, I get it.
Cheers, my friend.
All right. Well, hey, thank you so much for your time, and we'll get this going. If anybody has any questions, please feel free to leave a comment in the comments section of whatever platform you're on, and go ahead and text and schedule your next appointment. And yeah, anything else?
No, I'm just waiting for the call from La Tunnel Tech. I'm hoping
Yeah.
to get some sponsorship here. So
Free tacos if you're watching. All right.
have a good day, guys.
See ya.